Hello everyone. This is my second video and this is about the preparation strategy that I used and that worked for me. I was able to crack both theory and practical exams in my first attempt. Firstly, the first and the most important thing that I want to tell you is that at this point of time, it is very much possible to crack the exam, both theory and practical. Unlike earlier, it's not as difficult as it probably used to be because I remember that when I was planning to take up DNB Radiology, a lot of people told me that cracking both theory and practical exams in your first attempt is a little difficult. It's not like you cannot do it, but it is difficult. There was a time when people used to fail the exams, but I think it has become a lot easier with time. So let's get straight to the strategy. The sources that I used were primarily Navnigar notes and my seniors and their seniors, and we all of us have used Navnigar notes. Recently, people have also started studying from e-conceptual, and I think whatever works for you, you should always do that. It is not that you can only pass from Navnigar notes, or you can only pass if you see e-conceptual videos, or even sometimes even if you don't see anything and you've done very well during your residency, you have learned the cases on the go, you will be able to crack both the exams. So irrespective of what you choose, I chose Navnigar notes because it worked for my seniors. I thought it's going to work for me, so that was a simple reason. Secondly, Navnigar notes are actually good, I believe. A lot of people struggle with the notes because they're like ऐसा लग रहा है कि रटा मार रहे हैं या समझ नहीं आ रहा है. Agreed. You're not supposed to read the notes from the first year or second year also, for that matter. For first and second years, you're supposed to just go to the residency, see the case, come back to hostel and read up about it. That's all you have to do. And these notes are to be picked up by the end of second year or in your third year. You're not supposed to start reading them from the very first year. You will not understand one word that it says. So I got my notes at the end of second year, and I would read one topic. It was very slow paced. I would read a topic and then another topic in the next week or something like that. But I hadn't read much. So then came January. I was a little occupied, and then came February, and then that was the time when you will also have to work on your thesis. You will have to submit it and all. So a lot of your time will go. So you also have to be prepared about these other things that will come up, and you will also have your fat practical exam during those months. So believe me or not, the last year is going to be very hectic. Not only you will have to do the thesis, you will be preparing for theory, and then immediately you will be preparing for your practicals and all of that. It's it's very normal to lose your patience and all during that time. So I remember the last 2 months was when I actually dedicatedly started studying for the theory exam. And now I'll be talking about my technique. So for me, Navnigar notes was like the first layer. I read it. 60-70% of it I will understand, and then 30-40% I will not understand. So for that 30-40%, I used to either use Google, or I would use books, or I would use e-conceptual. So any topic that I failed to understand, for that I used e-conceptual. I have not e-conceptual has not been my primary source, but I absolutely loved Zenabora ma'am's videos. They have been very helpful. How I used to read the notes is that whichever topic I have read, I would put a date in front of it in the index page, so that the next day or the day after that, I will read that topic once again. So I do not believe that you need to read all 19 subjects first and then have another reading of all 19 subjects. If you work like that, you will not be getting more than 2 readings done. Right. So the strategy that I followed was I would read a topic, the next day I would revise it, and then maybe a week later or another week later that I would re-revise it. So that way I already would get 3 readings of one topic done. And that is the strategy I would follow for each topic. Now, how did I choose the topics? I had my own list made of all the previous year topics. I had them written down on the side of my notes. And then I had them written down in front of each topic that, oh, from this topic, this was the question that came. Because sometimes what happens is that when you're reading notes, you may feel that, oh, this topic is not important. They might not ask. Balki, that topic might have been asked multiple times. So it's very important to know what has been asked before. Absolutely do not start your preparation without that. It makes life so much easier. In our hospital, we got 1 month leave, complete 1 month leave to study. So that was very helpful. I believe a lot of hospitals give that 1 month. If they don't, then you have to start your preparation earlier. So in that last 1 month, again, I would wake up, I would read, I would revise. So that was primarily my strategy. But even the revision part, you have to understand there is something known as mind map revision. So what you have to do is you have to recall the topic without reading it from your notes. Because you've studied it once, you will have a basic understanding of the topic. See, in the theory or the practical exam, whatever you write is whatever you know already, right? So it has to be in your brain. It does not, you do not need to have a visual memory of the notes ki, oh mujhe exact word to word likhna hai. It is never going to happen that way. If there is a topic of TB, you already have some prior knowledge about TB. You have primary TB, post primary TB. You know, you need to know the key points. That is what you have to learn, and that is what you have to revise by mind map revision. Do not see the notes. You revise it in your head, and then you see the notes to see, oh, is there any important point that you have missed? Because these are the keywords that examiners look for. And how do I know it? Because there is something very good that DNB has done. That is, they have this FAT exam for theory. A lot of people don't take it seriously. They'll be like, "Theek hai," because it doesn't matter. A lot of people also might be very scared about giving FAT. The marks don't count. They do not matter. The exam is just to make you familiar about the pattern, about making you sit for 3 hours and write a paper, because you'll be doing that for 4 consecutive days, right? And it's not easy giving theory exam, like sitting for 3 hours and all. So they make you get a little bit idea of how it's going to be, and it's a great opportunity. Like, you don't have to know everything, but you can use that FAT exam as an opportunity to see how well you do. And I'll tell you that when I went to give the exam, I gave it my best attempt. Whatever I knew, whatever I'd heard in the department, I wrote everything down. I made diagrams as much as I could. I made flow charts and everything. And to my surprise, when I got back, I knew that I will not pass the exam. But when I got the marks, which was like a few days before my theory, actual final theory exam, I was surprised that I was very close to getting a 50%. And this is the most important part in DNB. This is you just have to get 50%, and not even 50%. If you are in the range of, let's say, so total is 400 marks for theory. If you get 192, you will be in that grace marks wala range. So you will get grace marks, and you can still clear it. So this is very important. Your ultimate goal is to just pass the exam, okay? And of course, if you do well, you're going to top the exam and all, but none of that matters. For you, the important thing is to get the degree. This is what you have to understand. And to be able to get that, you just have to get 50% marks. So then in the last 1 month, like I said, I had moments of breakdown like any other person. It's very, very normal, firstly. But remember that no matter how scared you are, I can assure you that you're going to do well in your exam. Now, coming to attempting during the exam. So my strategy was that I would write the topic, the heading, and then write subheadings and all of that. This is also one thing that one of my seniors told me, that what matters is the presentation. It is not about what you know, it is about how you also present it, right? So you may know 10,000 things, but if you're not presenting it well during the exam, it will not fetch you marks. So how do you do it? Go about it. Make flowcharts as much as you can. Make diagrams as many as you can. When I got back my FAT result, the theory, so they actually scan your FAT copies and they share them with you, and so that way you know for each question how many marks you got and how you have performed. Write everything in key points. That is what the examiner is looking for. If there is and there are certain keywords, that is what they look for. They don't want to read your story, they don't want to read lamba paragraphs and all of that. They just want those keywords. When it comes to attempting a question, start with the basic modalities like X-ray, ultrasound, special procedures, and then move on to the higher modalities like CT, MRI, PET CT, whatever, and then talk about the management part. So I really want to tell you this, that once you clear your theory exam, don't sit and overthink about it, that whether you will pass, whether you will not pass, because 1 month will pass by and you will realize that you have passed, and you have also wasted a lot of time which you could have utilized for your practical exam preparation. So now, coming to the practical part, I had fixed sources for a lot of things. Again, for practical, there are multiple sources. I used for OSCE and spotters, I used Navnegar module, which is available online. I used Radiology Without Tears Volume 1. So that covers your special procedures and Alara and Elora and everything else is covered in that book. It's a very, very good book. You should surely read it. And case-based, of course, whatever you have learned during your residency, that is what is going to help you during your OSCEs, during your Viva and all of that. Again, before the practical exams, there are a lot of things that are being conducted. One of them is DelRad, which is conducted by Apollo. I attended that. Do not feel afraid to sit on the hot seat and give answers. You may be scared that, oh, what if you make a blunder? What if people will laugh at you? Everybody is in the same boat. Everybody is equally scared as you are. Everybody is equally shy. Take that step forward, because that is what is going to help you in the exam. And if you do well in the hot seat, you will be in the top 20 people who will be selected for the film reading session. So make sure that you sit for the hot seat. eConceptual also has certain videos about spotters and DNB OSCE. So they were also very helpful. I haven't been able to see all of them, but I used to see once in a while and they have been quite good. The Pomodoro technique is something that I'm pretty sure all of you know it by now. You set a time, a fixed amount of time, let's say 25 minutes, 30 minutes, whatever works for you. And you just study during that time. You study in cycles. So then you can take a 10-15 minutes ka break, and then you can again study, and then you can take another break. It's very, very, very helpful. And I have these two techniques that I have used, Pomodoro technique and mind map revision, is what has helped me. And lastly, something that I have not shared, only very few people know. So before my theory exam, my grandfather passed away. I was very, very close to him. And this happened 2 days before my exam, before my final theory exam. And I remember that I had given up. It was difficult, but the only reason I am telling this to all of you is that a lot of things will come up during the residency. It could happen one day before the exam. What you have to understand is that you have two choices in life. Either you can keep moving, or you can give up. As much as I wanted to give up, I did not. I knew that my grandfather would be the most happy person to see me succeed in life, and I used that as my motivation during that time, during this last one day where I was handling my suffering as well as trying to prepare for the exam. You have to take that fear out of your mind that what if you fail? uh, Anything can go wrong, trust me. On the day of exam, I have known people who have been sick, and nothing is in your hands. So do what is in your control and just believe that you can do it. I know you can do it. I know everybody can do it. And most importantly, stick around with people who are going to help you during these times when you will be very, very overwhelmed. I had, in fact, during the theory preparation, I made certain friends. We used to do the Pomodoro thing together, and I found some very helpful seniors who would guide me whenever I would feel low. Um, Stay with such people, avoid negativity. Anybody who says, oh, what if you fail, you cannot do it, tell them it's okay. Even if you fail, it is okay, trust me. So all the very best. Any question that you have, you can put it in the comment section. I will try to make the next video with my friend. It's been a long due video, we have been trying to make it, but both of us have been very busy with our lives. So yes, okay.